Thank you for making time.
Yes, of course.
Um,
No small thing running two companies at once.
yeah, no, especially now with, I mean, everything has gone virtual, so I'm sure things are even more crazy for you.
So crazy. Yeah, it's been a huge learning curve as everybody has gone through, but and been pretty incredible since we were 100%. I mean, Boober was all about in-person care, and I thought, we'll leave virtual care to all. There were all these other companies doing that already, and I'm like, I'm all about in-person, and then pandemic struck, and now everybody is all about virtual care. Of course, here we are.
Well, I mean, I guess, those, the crappy things are always a blessing in disguise somehow. And I guess now you're on both platforms.
Yeah, exactly. I mean, that's what's been so incredible, again, as the last person, ever who wanted to do virtual care, to see the feedback coming back from our customers and saying, oh my God, this visit changed my life. Like, I'm not in pain anymore. I can do this.
Mm-hmm.
Like, that's been so incredibly rewarding. And in a virtual space, of course, you can help people who didn't have access to care before. You can pop in more easily to people when it's not safe, of course, in a pandemic. You can still support people. It's been really, truly amazing to be able
Nice.
to actually, yeah.
Good. I'm happy to hear. It's so Boober is your second baby that is a branch off of your birthday presents. And do you say birthday or birthday?
I guess I say birthday present. I say birthday presents. It comes out that way, but it's 3 words. And
Because it's about the birthday, which is funny because I never thought of, when you have your kid, you're like, oh, I'm my day of labor or delivery, whatever. But one of the nurses that was helping us, she said, oh, happy birthday to my little one when I had her, happy birthday. And I was like, oh my God, that's so cute. Like I never thought,
right.
Because it's not a birthday, but it is the true birthday.
Right. It's and I always think about it's not only your kiddo's birthday. It's like it is your birthday. It's this day that you labored and birthed your baby, and it's pretty powerful to be there on that day with people.
Definitely.
So, yeah.
So tell me a little bit more about Get Boober, and then also I want to know about Birthday Present because
Yeah.
I know they're intertwined, they're connected. And you're a doula. I'm super bouncy, so you might have to rein me back in when I, bounce.
No worries. Yeah, no, it's fun to talk about how they're intertwined and where they came from. So, I'm a maternal health expert, birth doula, postpartum doula, lactation counselor, mother, stepmother. I got started. Birthday Presents, my first company was started in 2002, many, many, many moons ago now, 18 years ago. I originally got into this work actually by being invited to a friend's birth. I had just gotten a camera for my mom, so I was excited about photography, always interested in women's health, had really been interested in college, and understanding some level of reproductive health was very interesting to me. I even did my senior dance thesis actually on the medicalization of childbirth.
Wow.
So
Wow, that's so interesting because now it's like there's a whole movement. Now that I'm like digging into it, there truly is a whole movement of, the free births and, all these other types of birthing processes. So I'm sure that, it's crazy when you really dig into it because it's a whole world.
Oh yeah. Yeah, it is a truly deep world, and so many people, don't really know about their choices and options around childbirth till they get pregnant, and it can be really challenging to suddenly have to take a deep dive into this education rather than just kind of following what's been prescribed. So a lot of people, unfortunately, have fairly negative birth experiences the first time before they realize what the system in America looks like for birth. And I think, I got really interested, at least in my reading, about that medicalization of childbirth and why it was the way it was. And then a friend of mine soon after college got pregnant and invited me to her birth. And I had the camera and I was like, oh, can I photograph it? She's like, sure. So I went to her birth to photograph the birth. But when I arrived, there were actually 19 other people there. So there were 20 of us at this incredible birth. And it was at a freestanding birth center. And, she was walking around on a birth ball, in a shower, on a bed, in all sorts of positions, just blew my mind about truly like what childbirth could be. And it wasn't something that most Americans see in their experience of what they think birth is, how it's portrayed in the media. So that was a really incredible experience and got me just deep into what birth could be. And then I went to a birth conference that was on the Upper East Side in New York City soon after that. And I met somebody there who, even though it was on the Upper East Side and I lived in Williamsburg at the time, she was like, "Hey, do you get off at my train station?" I was like, yeah, I do. That's a little weird. But and it turns out she was holding a doula training. I didn't know the word then. I was like, "Oh, what? Can you explain that?" She's like, "No, it's this amazing, you'll become a birth coach, support person. You're going to learn so much about this." And she's such an amazing person. And it turned out this woman happened to live with somebody I knew from high school and lived 3 blocks from me. So I was like, okay, I'm going to a doula training in a few days. And so I went to this 3-day deep dive immersion training. I was so blown away by what I learned. I met another person there who she and I just immediately partnered up, and we were like, well, we need to tell everybody what we just took. We just went to this doula training, and let's go to births. And so I started telling everybody what I knew about birth, and hey, do you know any pregnant people? And they started getting referred to us left and right. And I went to a whole bunch of doula births. I was the doula there, without we hadn't fully figured out what we were doing yet, but the calls started kind of coming in, more and more. And we were like, oh, we're doulas. But I realized as a doula, that so many of my clients didn't truly understand their choices and options, and they weren't really educated about what birth looked like or what they could say yes to or say no to during labor. And so I really found myself becoming passionate about education, and our meetings with our clients were just taking so long because we were educating them about the whole of their options that I realized I needed to become a childbirth educator. And so I started teaching childbirth classes, first out of my apartment, actually. And the people came. I couldn't believe it, And then they were starting to get more crowded in my teeny space, and we looked for a space. And once we opened our location of Birthday Presence in Park Slope, people really started to come. So Birthday Presence really grew into a childbirth education center, and over time a doula training center. And we've now, helped over 20,000 parents in the New York City area prepare for childbirth. We added in lactation classes, newborn care, infant CPR and safety, kind of all of those classes to help parents along. And over the years started bringing back that doula trainer to come to Birthday Presence and teach the doula training. So Deborah Pascali-Bonaro, who teaches our doula training, started coming regularly. And now we do about 8 doula trainings with her a year.
Wow.
Yeah. So Boober, which is my second baby, I call Birthday Presence, is my, almost teen graduating, going into college. Boober started a few years ago, and it really grew out of my customers, out of the market at Birthday Presence. Just so many people, they would give birth, and we gave them a list of lactation consultants to call, in case they had any problems after birth. And we started to find in the last few years that people, they would call down the list, they would call 5 people, 7 people, and they couldn't get anybody sometimes to come help them within that day or next day. And we know that people struggling with lactation will find that, if it's really bad, if it's really hurting, if the baby's not getting enough, they will give up pretty quickly because it's just so dire and need the baby. And when you're in pain, it's not sustainable. And I was like, this is crazy. We live in the day of on demand. Like, you can get your dog walked, you can get your, your makeup done, you go to Glam Squad and come over and do your makeup in an hour. It's crazy. So why can't we get this for the most critical support for parents, that they need? And I just started giving out my cell phone number on a postcard to all of my students. Basically, it's a Texas number if you have any issues with nursing, or with feeding your baby. Like, we've got you covered. And I knew so many lactation consultants in the city through my 18 years of work here, and through my training that, I would text people, and I'm like, oh, somebody came in, like, okay, hey, who's available? And I would just text all my colleagues or myself. I would go if I was qualified or if it was in my area. When the text started rolling in faster than I could keep up with Boober, was formally born. So Boober was all about on-demand, in-person, same-day lactation support. And over the years, in the last year before the pandemic, all of the birth and postpartum doula matching I had done at Birthday Presence, because I had done that for years as well. I decided to bring onto the Boober platform. And now Boober is really, we call it, a platform or a marketplace where expectant parents and new families can find all of their pregnancy to postpartum care providers, from birth doulas to postpartum doulas, lactation consultants. We launched mental health therapists, fast-tracked that when the pandemic struck, because obviously it's just so much stress and anxiety for all of us, but especially imagine if you're pregnant. And now in the next coming months, we're adding pelvic floor therapists, nutritionists, sleep professionals. So kind of all of, we're really a place where parents can find all of those service providers they need to thrive through their pregnancy and postpartum. And we've also now brought all of the Birthday Presence classes onto the Boober platform. So ultimately, Boober is a place where you can get classes and care for pregnancy to postpartum. Birthday Presence is going to continue to remain as a training center. And then all of for the customers, classes, for the pregnant people and parents, it's going to be all the classes and care at Boober.
And you have a membership for that. You're going to continue that?
So I think we're going to relaunch what it is, to make it really make a lot of sense in our new space. We had a membership at Birthday Presence for the classes, and now we're kind of refining and figuring out. It's been interesting in virtual space, right? What people want. Again, we were a total local in-person class space. But now we're doing, the virtual classes has been so interesting because we have people now from all over the country coming together as well. And so we're trying different formats. We still have live interactive classes where the parents can see each other if they want, or they can come to webinar style classes, where we're more talking to them and doing a slideshow and teaching them. So a lot of different formats. It's been really, really interesting.
Yeah, so my little one is 8 months old. So I had her in the middle of the pandemic. Or the beginning of it, like the height of it, essentially. Wow. So it's interesting because this is why I started the podcast, because it's like my mom couldn't come, my mother-in-law couldn't come, like no one could come because like only a week before because I went to 41 weeks in a couple days. And when I was at like 39 and a half weeks, that was when they said your partner couldn't come in the hospital with you. So it was like, because I'm also in New York City. And there is such a, there was just so much going on. And then at one point I was like, well, maybe I should try to look into a birthing center or at home birth and I was just digging and I couldn't find and it's amazing that you have literally everything in one space, which is when I came across your platform. And then I realized that it was both, Boober and Birthday Presence was you. I was like, oh, this is genius because New York City, and I don't think people understand this unless they live here, it's such a tiny city. Like, it's such a small place where, someone knows someone who knows, and you always know someone. Yeah. So it's really, really nice that everything's been able to come full circle for you. And like, you could just put it together on the same platform, and all those years it's like, duh, like this just makes sense.
Yeah. I just want to make it easy for people so they're not stressing, vetting, searching, constantly going everywhere. And I have to go on this Facebook group and ask these friends and all these people. And yes, you still want to hear from your friends and you should, right? But it's just so disparate and hard. I wanted to make it really simple.
Yeah. And it is like, now that I've gone through it without anyone having to see, because when I was searching through your website and stuff, it's literally like, it's the labor, the delivery, the breastfeeding, the lactation, everything is, and it's so just organized. Like it's all there. So it's really nice to see because as you know, there's so many things that happen that you can't, even if someone tells you, you don't really know till you get there. Right. So having just a space to go is like, such a godsend, like just boop, there it is.
Totally. Yeah. No, and I think, community building is such a part of it too. Obviously in person we did more of that, but I think even in the virtual space, like we have these classes where even though you're all like little squares on a screen, you're still getting to talk to other people who are going through what you are, Yeah. And even when we do webinar style and they're not seeing each other, I love like when the parents chat I'm like, okay, no, chat it to me. Tell me where you are. Like you're all sitting there growing humans like together, whether you're in Brooklyn or you're in
Minnesota, wherever. Yeah, no, right. It is an important, which is also why I started this, because I'm like, it's the middle of COVID. I'm a new mom. I
Yeah.
need, like, I can only talk to my mom so much and my sister and my
Right.
friends. Like, I need to, have adult interaction and other
Right.
senses besides work and like, I need to know what other women are doing because it's really hard to find even just like the mommy and me groups and, that type of
Totally.
stuff it's a weird, maybe it's just New York City. I don't know because this is where we are, but it's such a weird time. I can imagine being pregnant now and
Yeah.
being so unsure because when I was pregnant and up until April, it was so unsure. So now having a little one, it's like it's even more unclear.
Totally. I mean, what you went through, like it's very profound. And to have found out that your partner couldn't come in, did that ban get lifted before you got in?
Yeah, thankfully everything. I mean, I think that everything was perfect. He came in. We delivered at Mount Sinai, or no, sorry, Lenox Hill. So it was we're on the west side, so it was literally like it's normally, it could take 45 minutes to get there straight across the park, but it took 5 minutes. So
Wow.
like, the good things and the bad things that come with COVID. So yeah, straight across Lenox Hill, he came in, no problems. And
Great.
honestly, we didn't see one other couple. We only saw doctors, nurses. It was a very smooth experience, thankfully,
Yeah.
because I heard horror stories aside from COVID. So being that it was COVID, it was actually very peaceful and easy.
Really interesting. Yeah. Because I guess so many people left the city too. There were probably a lot less
Yeah.
numbers. It's interesting. Yeah. There was such a, like you said, you were considering birthing somewhere else. I actually wrote a blog piece about home birth pretty early on, saying, hey, you might want to consider some alternative. This is when we really didn't know what was going to happen, right? Like, were the hospitals going to be overrun or not? Like, or for the people, I kind of wrote it for the people who had already been considering home birth or, they were like debating. I said, now might be the time because we don't really know what's going to happen with hospitals. And at first I got some really upset emails. People were like, how dare you suggest that might be a thing? And I was like, oh God, I never.
Well, why not though? I mean, because I think also since you are very familiar with this world and the more I'm digging into it, the more I'm realizing that the US, we're such outliers. Europe, everywhere else, it's very normal to use a midwife, a doula. Like it's common practice. And we're just run by this, this other, the doctors. And it's a really interesting thing how they've almost brainwashed us. I don't know if that's, and so they make it seem like we need them. But and I say this, and anyone who listens, no, I sound like a broken record, but this is what our bodies are made for. This is what we're built to do. So we shouldn't be brainwashed to feel like it's dangerous. Obviously, if you have health conditions, that's a whole different thing. But for a generalized, a healthy lady, this is what you're supposed to do. This is what your body's made for. So to have a doula, have a midwife, your body will just go through the steps.
Yeah, absolutely. I mean, that is one thing that, midwifery was so undermined in this country, and all of the studies do hold out. And I would start by saying, we support all parents no matter what they're doing. It's really important to know that there's just so little education about it and so few midwives actually that people don't even know that it is an option. And a lot of people, still they'll say like a midwife, what? Is that still a thing? Even though that's the primary clinical care provider in all other countries, right? Midwives are who you see for birth. So it's really only in the US where you'd actually see a surgeon for a very normal process, whereas in these other countries you always have surgeons, OBGYNs are backing up the midwives, of course, because you always need to work in tandem with them to keep birth safe. You need both aspects of the care, but the average normal low risk person, ideally, if they're using midwifery model of care, we're going to see way lower rates of cesarean birth and the complications that can come along with that. So it is interesting. We have such a high C-section rate, and not to say again, C-sections have their absolute place, but we very much overuse them in this country. And there's very little education about, what it would look like to work with a midwife or to use midwifery care. So I am a huge, huge believer in the midwifery model of care, and getting that education out about it. And ideally in my, ideal world, we would see midwives and OBs really working in tandem. And we do see that in some places here, even, there are some pockets where it's happening.
Yeah, I think I mean, also, my biased perspective because I live in New York City, it seems like things are going towards a more holistic approach and that way. So I hope that this is something that's going to be a bit more normalized, which I think that it's just spreading awareness. And with social media and all this, I think that it's so much easier and more readily available for people to have access to it so they can, do their research and see the actual statistics and what's happening in other countries and how it is a better option if that's, something that you want to consider.
Yeah, I mean, absolutely. And especially with the maternal mortality crisis that we're experiencing here, especially for Black birthing people, in New York City, 8 to 12 times more likely to die. And, I mean, that's just a statistic that should be unheard of. And we know that using the midwifery model of care is one thing that would make a huge difference, and kind of taking the tradition back. And there are many amazing Black midwives here who are working on mentoring, more midwives, getting more community midwives into the system, because right now that is one of the problems is our systems in general really are biased against midwives. And then of course, if you add in the systemic racism that you'll see within our institutions, that is directly contributing to the unnecessary death, especially of Black and brown parents. So in labor.
How do you think, because you're around this, you see it, you deal with it, how do you think, or what do you think is the route to help fix it, or at least kind of get in that direction? Because it is something that now that I'm digging into it, I'm hearing a lot more about it, and I don't know if it's just because of this big movement that's happening, or what it is, but obviously I hope everyone wants to do their part to help with these issues that are happening. What do you?
Yeah, I mean, it starts, I think, with the institutions evaluating themselves. It starts with our healthcare system in general, our insurance system, which is, really despicable and doesn't serve all of the people, and is inherently racist in that, especially, if you can't, we have many doctors who are allowed to not accept certain insurance, such as Medicaid, for instance. We don't have a national healthcare single payer system, which would eliminate many of the disparities. That's on the table right now in New York State. So that's something we would really need ACOG, the American College of Obstetricians and Gynecologists, to really bring and recognize midwifery back into the fold as the midwifery model of care, as one of the the healthiest way that lower risk people can give birth, and really support that. We would need to set up systems and institutions that could train midwives and make it accessible, especially to lower income people. The training costs are often a big barrier. That's one of the things that at Birthday Presence we are providing scholarships and pay what you can spaces into our lactation counselor and doula trainings to allow people to enter into this field at a lower cost or at no cost, depending on what their circumstances are. So, we have a BIPOC and LGBTQ plus scholarship system. And we're working at Boober right now on adding into, when somebody books a visit, that's still, we're working this out right now so that we can figure out how to make the doula care more affordable to people who can't afford it. It all kind of starts in this system, having doulas, be able to be present with all people. Makes a big difference. Doula care reduces, when you have a doula, you're much less likely to have a cesarean birth when you have that advocate with you, advocate with you, right? So especially for Black and brown birthing people, to be able to work with doulas and have doulas that are able to be with them, we'd like to figure out a system of how do we make that really affordable and accessible. Is it, that Medicaid begins covering this care? There is a Medicaid pilot program, but it hasn't actually fully worked yet because of the amount of reimbursement that they're providing for the doulas. So there's a lot of organizing and activism, that has to happen. We have, people, like, there are amazing organizations, community-based organizations like Ancient Song Doula Services in Brooklyn, run by maternal health activist Chanel Portia, people like her, her who started this organization years ago to really make a difference in Black and Brown communities. So a lot needs to be done still, absolutely. But it's really the systems themselves need to decide that they don't accept this anymore, and that they don't, accept these disparities in healthcare system. And, we've seen just even from the systemic racism and institutional racism that shows that Black people, don't feel pain the same way that white people feel pain. So Black people are not being offered or listened to when they say, I'm in pain. Serena Williams is probably the most
yeah, that's such a famous
example.
case, yeah.
Right. She's a famous case of a highly educated, well-off Black person who said, something's not right, and nobody listened to her.
And she knows her body of anybody. Yeah.
So that's the most common complaint we hear often. There's from Black and Brown people about just simply not being listened to, and that their personal opinion about what is happening inside their bodies doesn't matter, and therefore they're at higher risk because people aren't listening to them when they know something's wrong, and maybe they're bleeding out and nobody's listening, right? So actually, a woman named Kimberly Seals Allers, who's another incredible maternal health advocate who wrote The Big Letdown, and she just launched an app. She's launching an app right now called Earth, which is the Earth app, which is it's like a Yelp-like review app where Black and Brown birthing people can review their doctors, their nurses, their hospital experience.
Yeah.
And really talk about were they cared for and how were they cared for, or what was ignored. And she's hoping that within there, it's going to be really data driven to be able to really shift and show the hospitals and say, look, this is what's happening in your institution. So I'm really excited to support Kimberly.
Yeah, I'll have to reach out to her and try to get her on here or connect us or something. That'd be awesome. Where is she?
She's based in New York City as well.
Oh, nice. It is. See, it's a small city.
Yeah.
It's so interesting because it is, well, there's so many points to what you're saying, and every single point I agree with. Just adding on that having gone through such a, I guess, pregnancy, labor, delivery, all this stuff, it's like, even as a white person, even though my grandma's from Mexico, so I don't know, I could be brown if I'm tan. Anyhow, they don't listen to anything you say. Like, even as a white person or whatever you want to call me, they don't, like, I went in and and obviously you can't have a plan. You have to roll with the punches and whatever happens. But I specifically said, I want to do this as natural as possible, blah, blah, blah. And I was ready to endure the pain. I was ready to go through it. I don't have any risk. I don't have any complications, nothing. She was down. She was exactly where she was supposed to be. And just out of nowhere, because the doctor, honestly, I think it's because he was feeling impatient. I don't know what it was, but I feel like that's typically the case because it's a numbers game. Like, I want to get this person out, get another person in, be done with it, rack up a bill, charge money, blah, blah, blah. So it's like, and so anyhow, my point is I end up having an episiotomy just because I'm assuming he didn't feel like waiting. But that was never even a discussion. It was never, hey, I'm going to cut you in half now. Ready? It was just, he did it. And I remember him just grabbing the shears and I just remember being like, and you can't pause it. You can't say,
right,
hold on, stop, no, because especially on your first one, you're just kind of rolling with everything that happens. So I can only imagine how these other people feel when they, because they don't listen to anyone, it seems like.
Right. No. Yeah. I mean, they really don't. I would say, women are devalued in general in our society as well.
Definitely.
And there is a lot of authority, sort of like, I am the authority here to deliver your baby and I'm going to, make that decision. And I think that's really one of the differences in the midwifery model of care as well. And some doctors, by the way, there are OBs who practice in the midwifery model of care, and there's some midwives who are more medicalized. So right. I really talk more about it as a model of care, midwifery meaning, with women or with birthing people, that we ideally want our care providers to be really engaged together with us in our care, and that we are hiring them to keep birth safe when it does go off course. And there are times where you do need an episiotomy or a C-section, right? If the baby's heart rate is significantly lowered, or there can be reasons, but we would want ideally for that person to really say, unless it's a true extreme emergency. And even in that case to say, we're having an emergency, I need to do this, right?
Yeah.
As opposed, and if it's not, then to be able to really speak to the birthing person and say, I'm really thinking about doing this. Like, I want to tell you what's going on in between a contraction, and give you that opportunity to talk about it, even though, of course, it's very challenging in the moment, no matter what, because talking while you're not in your, right brain, like all of your mental faculties are you're in your animal brain, ideally. You're in labor, you're in an instinctive place. And that's why we want to really know that we are working with the care providers who ultimately have our backs, and that they are only going to make certain decisions that are interventive if they absolutely need to, and that we trust them, ideally, to do that. So it's a challenging place, to be when you're in that vulnerable state.
Well, and I think that the point of having a doula or having someone with you to advocate it's super, super important, because if it almost seems like when it's and I get it, first time, second time, third time, whatever it is, the first time you really have no idea what you're going into. So to have someone there, and even like, I told my husband, listen, I want this to be as natural as possible. I don't want them to cut me open unless there's a risk of death or, something horrible. But going into it, there was, and my husband doesn't know. How is he going to know what he's grabbing the scissors for? He's not even looking. He's just holding, he's just saying, you got this, babe. Like, he doesn't want to look and see anything. So I think that it's to have another woman there who knows, who's been through it, who can say, whoa, hold on, what's going on? And just, because you do have a second, you do have 2 or 3 seconds to talk it over and have a plan. And I think that, going to your point of, they need to essentially merge with, midwifery, and to put everything together, they need to okay it. I think that there's just such a big disconnect, because as soon as the midwives and the doulas and that comes in, that's when the money slows down, because you can't just, push people through like numbers,
right?
Because you have to go.
Yeah, I mean, that's really the problem.
Yeah.
The less intervention we have in childbirth, the less they can bill, to be perfectly honest.
That's exactly what it is.
Right. I mean, we have a system right now that is literally based on billing procedures.
Yeah.
And that's how your care provider either makes more money or less money, or the hospital. It just doesn't make any sense. It's antithetical to how labor normally works, which is that it most of the time works, and it can be a slow process for many, and it takes its time to unfold, and it requires a human being to be with you for much of the time to support and care for you. So it's really not a big money-making proposition. It's interesting when you look at hospitals that have birth centers. In New York City, we lost all of our birth centers in the last few years.
Insane.
And especially like the big one that was the most popular one at it used to be at St. Luke's Roosevelt, then it became Mount Sinai West. Mount Sinai bought it, and then they eliminated it last year. And because birthing centers don't make money, because the people who birth them, they tend to have very few C-sections. They tend not to request pain medication. They tend to have a normal physiologic, healthy birth experience for the most part. And so there's just a whole lot less billing, but a lot more one-on-one patient care required. But they say that if you have a good experience at a hospital, in theory, you're going to go back for more. And that's why some hospitals keep those birth centers. They lose money. They're called a loss leader. They lose and they lose and they lose, because our system just doesn't make sense. And as long as we're living in this system that is all about billing, I don't see how the patients are going to get the best care that they need, and then you look at the countries that do use midwifery care as their first tier level of care, they also have socialized medicine, generally. So it's a whole systemic issue right now, which is forcing people to have to pay for doulas out of pocket and pay for lactation care.
Yeah, but even then, I honestly, having gone through it now, it's cheaper. I still think it's a better price. You end up saving than going through, your OB and your doctor and the hospital and this and that, than just doing a midwife or a doula and the lactation consultant.
Yeah. Right. I mean, and often having these things, like what we're hoping is that insurance companies come around and get it, that like, if I have a doula, I'm less likely to actually have a C-section, and the insurance company has to spend a lot more money if I have a C-section, right? So if they could start paying for this kind of preventative wellness care up front. But we know also, like in the US, we tend not to be, we don't have a lot of forethought like that. We're not super into wellness, although it's getting more common, right? It's getting more popular.
Better.
It's getting a little better, recognizing things like acupuncture actually can be really helpful and preventative. So, we're seeing like these little increments, but for the most part, we still are needing to pay for a lot of it out of pocket. And like, that's something I'm working on right now at Boober with lactation, because according to the Affordable Care Act, you're supposed to be able to get your lactation visit fully covered, even if they're not on your insurance. And it's really tricky, especially in New York City. There's so few lactation consultants who are on insurance, because the insurance companies won't keep very many people on as lactation providers. And so you end up in this situation where you're like, okay, you call the insurance company and they're like, well, I have one lactation consultant who's in Westchester and you're in Park Slope, let's say, which in New York, if you live there, you're
it's like a across
that's
the world.
Not a thing.
Yeah, you don't go.
We're not in the same area. Even Upper West Side, like you can't make a person with a brand new baby go from Park Slope to the Upper West Side. No. That's insane.
You have your little, 5-block radius, and especially now with COVID, you don't go out of your little neighborhood.
Exactly. And so, technically it's just this whole rigmarole you have to pay up front and then get reimbursed or try to submit it. And if there's not somebody on your insurance, then you can get this called like geographic gap exception. But who with a baby has the energy
or time
multiple times? Yeah. And submit the thing multiple times, get rejected. So it's really frustrating.
It's the same or very similar, I think, with, cause I've also done episodes with pelvic floor specialists.
Yeah.
It's the same back and forth. Like I've been going now, my little one's 8 months old. I've been going back and forth with my insurance this whole time. They want to pay, they don't want to pay. They do, they don't, the hospital, this, that. And I'm like, I'm going to keep fighting you. It's COVID. Yeah. I'm like,
right, I'm here.
I'm not going, I have time. I'm not going to, and I think it's the same thing. Like it's just back and forth. And
yeah. And like in France, right, when you give birth, you get a pelvic floor therapist that is part of your care, 8 to 10 sessions. It's only, in the US, like a few people know about it. We're starting to see more. We're adding. It's really crazy. And, I actually only recently went to my first pelvic floor specialist because I finally was like, I need to see what this is all about. I talk about it, of course, but I have a 13-year-old. And what a difference. Like there's a lot of things I wish I had done that much earlier, but again, you have to pay out of pocket. So, or you can find some people in insurance, but are they near you? Are they possible? Like it's something we really need to get more education out about, because it makes a huge difference to people's like quality of life and their body feeling and well-being and all of it. The more holistic, I think the more preventative and wellness care we can do around this, better going into all of it and having our baby. And I think, the US is is the only country where you're supposed to give birth and you don't see your doctor or midwife for 3 to 6 weeks, which is basically an eternity. In
that time period, that's like just the most miserable. Those first 2 weeks are just bleh.
It's vulnerable. It's intense. Yeah. And you're like in the other countries we've been talking about, I mean, you get home visiting nurses that come and check on you and
it's crazy
and look at your body and see if your, vaginal bleeding is correct or not, or if you're having any type of infection or what's going on. And yeah, here we're just like, okay, I guess I'm by myself.
Well, and I think that's what it is now. It's like, it's been going on for so many years. I'm sure women just say, oh, well, this is just normal. Everyone's doing it. So why do I need to be different? But the reality is it's not normal. It shouldn't be okay. And there's no reason that it shouldn't become a thing after you give birth, no matter who you are, no matter whether it's your first birth, your 5th birth, you see a pelvic floor specialist, you get checked out. And I don't mean an OB. Like I went to my delivery doctor, I think it was for the 2-week checkup. And he literally was just like, okay, you're fine. And that was it. Like, that's it. Didn't check for DR, nothing. And I'm like, like I was in fitness for a long time. So I thankfully know, I've done different, pre and postnatal certification. So I know, but I know that I don't know everything. And I also know that most people don't know.
Right.
So it's like, if you're doing this to me, I can't imagine how these poor other women feel.
Exactly.
It's horrible. Okay, so lactation, breastfeeding. I saw something. What is breast sleeping?
Breast sleeping is one of the terms that's kind of been coined. Mary Esther Malloy, who is a doula, was presenting that workshop. At Birthday Presence, we do a lot of extra training for doulas and workshops. And breast sleeping is this idea of how we actually, what is the normal order of things with a baby if we weren't told what to do? You have your baby right next to you. You kind of roll over, feed the baby, right? They're kind of half sleeping. They go like this in their sleep. You pop your boob in their mouth. They easily go back to sleep, and they're still sleeping kind of through this breastfeed session or body feeding session. And it's like we're in this state right now where people, in the US, we put babies in cribs in other rooms for a long time, right? So now the American Academy of Pediatrics finally recognizes that babies should be in the same room with you and should be close, obviously in a sleeping situation. But breast sleeping is just really talking about the real normal ways that babies kind of just gently rouse when they're nearby you and want to nurse off of you and kind of go back to sleep. And then the birthing parent can go back to sleep easily too.
I saw that and I was like, I get that. And it's funny because if that kind of phrase was only recently coined, because it's like, yeah, that makes sense.
Yeah, I'm not sure actually, like who coined it, and I haven't taken the class yet, so I'm looking forward to it.
Sounds like a good one. And then I have one. Well, I'm sure there's a ton of other questions I could think of, but one that I'm thinking of specifically about lactation is, and I don't know how true it is, so tell me what you know about this.
Okay.
Women who adopt or surrogate or someone who didn't necessarily birth the baby, it's possible for them to breastfeed.
It is possible.
How's that work?
We say it is possible for them to lactate. It's possible. It's not always possible. We don't want people to think that they can necessarily offer a complete and full level of breast milk. Some people can. It's really a hormonal driven situation. So somebody who didn't birth the child can use a series of physical methods to pump or extract, right? Like if you are using a breast pump or using your hands, there are protocols where you start stimulating really regularly because that stimulation is part of what tells us to make more hormone related to, prolactin and oxytocin to get the milk out. There are also medications that some people will take, or hormone additions that people will take. So if somebody is interested in what we call inducing lactation, they want to reach out to a lactation consultant and work on this protocol. They have to decide to what levels they're willing to go, to do that. And then also be prepared to know that it may not be the complete amount. And so some people who are adoptive, or the non-birthing parent in a partnership or et cetera, may use there's something called an SNS where they put a bottle up here of it could be donor breast milk, it could be some of their milk, it could be other people's milk, blended with possibly formula depending on what they get and what they have, and they put that there, and then they tape a tube down to their breast, and then the baby latches on and can be getting enough here, but then starting to stimulate the person and maybe getting some from them as well.
So interesting. It's the whole breastfeeding thing it's like, obviously, here I say it again, this is what our bodies are made for, but it's a wild thing because a woman who I actually had on recently, but we're also friendly, she breastfed for 10 years. I mean, 3 kids during that time period, but they're all close in age. So it was like 10 years of breastfeeding. And it just blows my mind that your body can just, and I mean, I'm sure you've seen, and you've done the research and all this on how the milk, it's in such different colors, and it varies according if the baby's sick or if you're sick or the age. And she was explaining, because the common thought is that if you're breastfeeding, it's like a form of contraception, right? So you're not going to get pregnant. but it's basically what she explained is that that's until about a year old because of the fat content or something. So it's just very interesting because it's a whole science, but it's so natural.
Yeah, it's really interesting. You know, when you, in terms of using it as birth control, the way it does make it much less likely that you will get pregnant. We want to be careful as, you know, what we put out there, because you, before you get your first period, you do ovulate usually first. And so you may, before you get that first period, ovulate and therefore could get pregnant but didn't know you were fertile yet. And so if you're using lactation, you know, in the hopes that it is going to make you not fertile, they say, you know, you have to be exclusively breastfeeding or body feeding. So it has to be very regular, very regular. You can't, like, once you start introducing even solid foods, which often for people is around 6 months, and you start to, you know, nurse your baby a little bit less, and that regular consistency happens, you know, you should rely on this method even less, because we start to, the hormones start to shift. So plenty of people have gotten pregnant even while they're exclusively nursing. But historically, you do see that the average amount of time people nurse their baby was somewhere between 2 and 4 years.
Wow.
In all cultures. And historically, you also see child spacing to be around 2 to 3 years, you know, in a lot of cultures. So if you are nursing quite a lot, that may help with that. But I still would be very mindful of 100% relying on it, because there are people who will certainly end up pregnant having not gotten that first period and didn't realize that they ovulated.
Yeah, that pull-out method is helpful. With that, the I just lost my train of thought. What is, I guess, I assume it's the WHO, their general guideline for exclusively nursing now? That's what, till a year, or what's the recommendation?
Yeah. So the AAP, the American Academy of Pediatrics, recommends exclusive, you know, body feeding or breastfeeding for the first 6 months. So the recommendation right now is exclusive for first 6 months, and then they say, and beyond as you wish. There's no limit to the amount of time, you know, and we know that a lot of people naturally will breastfeed if they don't stop. You know, babies often, they'll wean on their own. Sometimes around age 1 is common. Some babies a little earlier, but others will just go forever, you know, as long as, and of course they're eating foods as well, but it's very natural for babies to continue on. But from the health perspective, if we look at the health benefits of exclusive nursing and lactation, you know, they really see it as exclusively for 6 months. And obviously not all people can do that. And there is the possibility people can supplement as well, if possible, with donor breast milk or formula. Those are the only things that a baby should consume up to 6 months. But a lot of people don't realize that when they're being told to supplement, that they could, if they're not making enough, they could pump possibly to increase their own supply if they wanted to. If they're working with a lactation consultant, they could learn a little bit more about bringing up their supply through external stimulation, or that in some cases donor breast milk would be possible. I mean, that's something I'd like to see this country actually helping people out with, and making that a possibility as the human, you know, milk substitute as one option, of course. But, you know, I think that in terms of what the recommendation is, it's this kind of exclusive 6 months. And we do see benefits that we don't really talk about a lot, but you do see health benefits the longer somebody, you know, feeds from their body. You will see benefits like lowered risk of breast cancer, lowered rates of ovarian cancer, and various things like that we don't talk about so much. So it should just really, you know, it's hard when we start talking about is breastfeeding a choice or not? Yes, of course, every individual should be able to make their own choice. A lot of this is talking from a public health perspective, that people don't actually have the choice if nobody's there to help them.
Right.
People don't have the choice if they give birth in a hospital and there's no lactation support professional who is coming and really working with them. So if they're struggling, a lot of times a lactation consultant can make a huge difference. But if nobody's there to help them, then they don't have the choice. And there's a lot of cultural reasons why, you know, people aren't able to exclusively breastfeed, and some don't want to, of course. But the don't want, we really need to look again. There's so much, you know, racism in lactation support or availability. We'll see in the hospitals formula is offered much more readily to Black and brown parents than to white parents, and there's so many things packed connect into why people can or cannot breastfeed. So we really need to look at people's, histories in order to support kind of everybody. So, my goal at Boober is to really meet people where they are, whatever their path is, so that we can have people who can help the parents in, whatever their feeding goal is, whether that is 100% exclusive nursing, or whether they want to partially, nurse, or whether some people are exclusive pumpers. Some people end up formula feeding exclusively. I talked to one woman early on in Boober who called and was just like, on the phone, just started crying. She said, I don't want to breastfeed. She had a 5-day-old. She was just like, because she was trying to look for lactation help, and then she just started crying and said she didn't want to breastfeed. It was not like everybody else wanted her to.
Right.
I said, okay, tell me more.
Yeah.
Just like bawled and talked about it. And she said, you're the first person who said I didn't have to, so I didn't want to. I was like, absolutely. She was so engorged, she needed help. And I said, why don't you just meet with a lactation consultant who can help you make a weaning plan? Because, and then, she felt supported, and I don't know in the end what she decided to do, but I know that we supported her. And so that was a big deal.
Well, and it seems like, having gone through it recently, it seems like it's difficult to find the support for whatever it is. So like a girl who I had on here, who I am, friends with personally, she's a single mother. The dad isn't in the picture. She's a lawyer. She's not from here. She's from the Philippines. So having had COVID happen, her mom and her parents couldn't come to help. She didn't have help. She had to go to the hospital by herself. She, did everything by herself. And it's crazy because she was trying to nurse, and she did nurse. She went back to work, being a lawyer. It's pretty strict here in New York City. They didn't have like a nursing area. They didn't have a special designated thing for her. And she said that she literally just bawled her eyes out for the first week back at work because she couldn't keep nursing, and she couldn't be at home. Like, she couldn't pump, she couldn't do anything because there was zero support. And it's like, of all places in the US, you would think that in New York is, pretty modern, you would think, but clearly we're lacking when it comes to this, especially and she obviously is a smart woman, like she's educated, she's successful, but she couldn't finagle that part of it. And she said it just broke her because, she's not with her daughter all day. It's like over 12 hours of being separated from her, but she was willing to pump and to try to figure it out. But she just didn't have a space at the law firm to do it. And obviously when it's a male dominated kind of space, she said that they kind of shunned her from doing it essentially. And it's like, it's horrible. It's so sad.
It's so heartbreaking to hear, and potentially illegal. But if that law firm
is definitely 100% illegal. But what do you do? Because she has to provide. She's
her job.
Yeah.
And,
but there's a lot of I guess corrupt or illegal things that happen. Being like, I went through a crazy situation where I was working, being pregnant, and it's like, just we're not disabled. They've created this, made it seem like you are, but we're not disabled when we're pregnant. Like, we're more disabled after we have the baby, when we're broken in half, and they expect you to just be perfectly fine and host and do all these things. But when we're pregnant, we're fine.
Right. I mean, I think it's our lack of post maternity laws about going back to work, right? In other countries, I mean, we just in the postpartum doula training last week, Deborah always updates us up on the latest stats. I think it was Finland that has 3 years of fully paid or close to fully paid. I mean,
wow.
It was amazing, right? And she just went through all the different countries, and then came to the U.S., right, where you're like, maybe you have 8 weeks. Some people have a few months, but not many, and it's just not built in or baked into the system. And so you wouldn't need the level of lactation consultant. Like, we have back to work visits at Boober where you can, hire somebody to do a one-on-one, how to get you back to work, how to advocate for yourself, how to work on your pumping schedule at work and try to keep the milk supply up. But like, why should you need that at all? That's crazy. That's not like a thing that you should have to learn or pay or have to do, because we have this system that doesn't support parenting as such an important role of growing up the future. Right? No, it's just go back to work and stop giving this like amazing life-giving milk, this milk that would create less illness in babies if they kept doing it longer. We know that, right? But now that mom who's not able to keep breastfeeding may have a child that gets a little sicker, possibly. That's one thing, and has to go, take a sick day to take care of the baby instead of just being able to be with the baby and nurse, or even, she tried to keep up her pumping, but the culture of the company couldn't support that.
It's crazy.
It's really crazy.
So you mentioned, and I've heard of this, I'm very vaguely familiar, the milk donation something. The woman who I was telling you about, who breastfed for 10 years, she said that at some point, even she wasn't pumping and she just was still producing because she was doing it for so long, that she was donating it, or essentially just giving it to a lesbian couple who recently adopted. So she said that it was so rewarding for her to do that, but she knew that if you go through an agency, it's very expensive. Do you know how that works, or what?
It is. It's very tricky. I mean, so there's all sorts of informal breast milk sharing systems, but the problem is you do have to be mindful that if you get breast milk from a stranger, there is disease that can be passed in breast milk.
Yeah.
So there is a risk to just going, and even though
hold on, disease can be passed between. How does that work? What is that?
There is some, like if there's HIV in the breast milk, there's certain things that you would not want to
transmit.
Very, very few things. A lot of things can't be, but they do screen breast milk. They, if you go through these formal places, and that's one of them. But it is expensive, and that's why ultimately it should be sort of like there's a national donor breast milk bank, right, where we could have a system of donation and getting. That's what I would like to see. And so there are these, like the Donor Breast Milk Bank of New York. You can apply in certain situations if you need it, especially for preemie babies who especially need breast milk, who that's really safer for. But it is very tricky. So if you know somebody, if you're able, I can't formally endorse it, but I can definitely tell people that there's tons of ways, and people that who may have extra breast milk, who their health status, and if you're comfortable with that, that people will do that, because it does need to be more accessible, and there are some people who have so much extra.
Yeah, it is, and going back to kind of diving into this world, my sister-in-law breastfed, and it came very easily for her, and she had just way over supply, so she was freezing it, and my little one and their little one just a few months apart. And it's funny because she was like, "Oh, I have all this extra, you want it?" And at the time I was like, I think that's weird. No thanks. But now that I know, it's really, and I think it's expensive per ounce or per, so it's really a huge thing to try to navigate through.
Yeah. They don't call it liquid gold for nothing, not only because it's expensive, but it just has these antibodies and the properties, especially versus colostrum. So
definitely. So I want to keep talking because I think that there's a lot, but I know, it's, you got stuff to do, I got stuff to do. Do you have anything else you want to share? Any other things you're working on? Any links I can include? Any?
Yeah. I would just love for people to come to Boober. It's at getboober.com, or visit us on Instagram at getboober on IG. We do a lot of, you'll find me there doing Tip Tuesday. I do a lot of fun little videos doing teaching. We also just, we want to be a resource to everyone who needs care or support. So we've, like I said, we launched our classes, which has been really exciting. So I do like a great prep for postpartum class, which is 1 hour, $15. There's a lot of great pain coping classes that you can drop in on that are unique and interesting, where you practice guided visualizations or breathing or movements and positions. I'm trying to kind of chunk up childbirth education. So some people may have taken somewhere else, but just want this little supplement, which can be really nice. We have a fantastic infant CPR and safety class. So all of our webinars are live and interactive and really, dynamic and fun and engaging. So come to us for some classes. We do tons of free webinars. We do a COVID resources page as well, where you can get more information on, as to how COVID is affecting nursing or whatever you're going through, a great blog that we work on a lot. So, I just hope that the people, if they need care, they know that they can get it, that they can reach out to us virtually now so we can support people wherever they are. And a lot of places due to COVID, doulas are not allowed into a lot of hospitals.
Really?
Yeah. In New York, they are allowed. We have an executive order, but I'm talking to people all over the country who are just like, nope, doulas are banned.
And horrible.
Yeah, it's really horrible. But, virtual doulas can make a huge difference. So I encourage people to think about that, even if they're like, wait, what? How is that possible?
Yeah.
Be really supportive and helpful to people who need that guide and want somebody, in their ears talking to them, or we can do videos and text you, show you, here's a great, pressure point, or here's a position to try, or really be on screen engaging with a couple or a parent the whole time to provide that kind of support during labor. So
I could see how that's helpful. I mean, I went in, I had 2 false alarms when I wasn't going into labor, but there was a little helpful thing where they said just, press on your hip, like push them together essentially.
Yeah,
and so I'm sure, wow, lifesaver. But I'm sure there's a ton of other little tips and tricks that, having someone in your ear on FaceTime, it would be a big, big lifesaver.
Yeah, it's huge. So I think just people are a little skeptical about it. So I'm still just encouraging people to kind of look into what is a virtual doula and how can they help me.
Yeah, I could see that being helpful. Cool. Well, thank you for your time.
Oh, yes. Thank you for having me. Lovely.
Absolutely.